Hi, I'm Vincent DeBono. I'm the Vice President of the Chiropractic program here at Keiser University on the West Palm Beach campus. It's a 3.5-year face-to-face graduate program, and it's a very unique program because it's a small group. It's in a very chiropractic-friendly state. We have a lot of opportunities to use all the skills as a chiropractor through conservative care to get our patients better. So if you have a person whose knee hurts, let's find out where that's coming from, because typically where you're hurting is not where the problem actually is. A lot of psychosocial aspects to go into this, patient's prior experience with trauma, that all plays into how the patient's outcome is going to be. So we've incorporated a lot of that now into the program here. Is really look at that holistic approach. We actually focus on treating the whole patient.
We do assessments, so we have assessments, it might be a lab practical, it might be a midterm or final written test. The students have so many they need to do to be assessed to meet a certain, what we call a meta-competency before they graduate. And so I'm in charge of just making sure that that framework is there and that we have training with the faculty and the students also, so they know what they're being assessed on.
Students who are debating whether to go to Keiser versus another school should really think about how Keiser puts their students first, and the smaller class sizes are going to be able to really get to know your professors and get to know your colleagues in a way that you cannot at other chiropractic universities.
Our faculty is very diverse. We have a few faculty here who are alumni of Keiser, but the most of us have come from different programs, different backgrounds, different types of private practice. That is very unique to chiropractic schools.
We really put our hearts into our education and teaching for our students. Having our classes a little smaller, we tend to have a little bit more hands-on experience, which is really good since chiropractic is a hands-on profession.
The program continues to improve every day, and I feel like that students first mentality really matters because we're able to make constant improvements and allow the program to become better and better.
Yeah, you're a student when you're here, but you're also my colleague. And when you leave here, you're still my colleague, and I hope you use this as a resource. And a lot of what our goal here as the program grows is what can Keiser do to contribute to moving the profession forward.
At some point in time, you're going to be a chiropractor, and so as we work our program through semester 1 to even semester 10 is engaging the students to make sure that when they graduate here, as soon as they get licensed within the state of Florida, they should be able to practice, and hopefully we've instilled confidence in them for them to achieve that goal.
It's a serious commitment because you're going to be taking care of patients, and they're kind of putting their trust in your hands and their health care. That's a massive responsibility. So like I said, the program's, it's not very easy, but it's worth it. I've been doing this for 36 years, and I would do it again in a heartbeat.